Hi guys, I'm Dr. Tara Tobias. I want to welcome you all back to my channel. In today's tutorial, we are going to talk about big picture, some alternative positions that you can get into to perform exercises after a stroke. But before I get into that, let's talk a little bit, just to review things I mentioned in some other videos. If you're just now joining us, it'll kind of get you up to speed. But after a stroke or a brain injury, this also happens with any kind of damage to the brain or the spinal cord, our body starts to move in patterns in the lower extremity. A lot of times it's either all extension or all flexion. And in the upper extremity, it's usually all flexion. So when you try and bring your elbow up, your wrist usually flexes. And if you try and bring your arm up, your elbow will flex in and bring your hand in towards your face. So a big goal in therapy is to learn how to isolate joints and work out of those patterns. So in the leg, you want to be able to stand and you want to be able to keep your hips straight and the knee straight, but not point the foot. And you also want to be able to bend the knee without the hip flexing up when you go to bring the leg forward. So a great way to do that is to think way back when, or if you have kids, what they did at the beginning of normal development. First they rolled, then they crawled, then they learned how to get up on their knees. And then once they were up on their knees, probably holding onto a piece of furniture, they quickly learned how to bring one foot up, which we call half kneeling. And then from there, they learned how to stand up. So that's actually like a progression that we go through to learn how to coordinate movement. You can use that same progression after you've had damage to your brain or your spinal cord. So what are the benefits of it? Besides the fact that it's just a normal developmental sequence that we've already gone through to learn normal movement as we developed, there are other benefits as well. So we'll start with kneeling, for instance, tall kneeling. So tall kneeling is when you are on both knees. And the benefits of this position are that you are learning how to extend the hip, but your body weight when you're on your knees is actually keeping your knees flexed. So that is the benefit. You're isolating that hip extension. So you're isolating, keeping that hip straight without your knee also going straight. Two, this is also a really safe position to start weight bearing on your legs. You're a little bit closer to the ground. You don't really have to worry about controlling the knee or the ankle. You just have to worry about controlling the hip. So in the early stages of recovery, that's another benefit of this position. And then of course, once you've got weight on both knees, you can work on challenging that involved side or that weaker side a little bit. And again, you're still in a safe position. So you can start shifting some weight onto that leg, testing that hip out a little bit, testing that stability out a little bit. And again, you're in a very safe position. The next position that we do a lot in therapy is what we call half kneeling. So that is when you're just on one knee and you're up on the other foot. Now the benefits of this movement, in addition to everything that I talked about with tall kneeling, half kneeling, you are still working on all of those same things that I talked about in half kneeling as far as getting that hip stability without having to worry about the knee or the ankle. But by having that other leg up in front of you, you're also working another component that's important when you're going through recovery. And that's what we call like dissociating. So a lot of times after a stroke or a brain injury, both legs want to do the same thing at the same time. And that's not really beneficial when you start walking because your legs are actually doing opposite things. So you're actually learning how to dissociate your right side of your body from your left side of your body because they're doing two opposite things when you're in this half kneeling position. Now you want to do it both ways. So not only do you want to have your involved leg or your weaker leg down or in the back. That's important because again, you're working that hip stability without being able to have the other leg doing the same exact thing. But you also want to switch it. So you also want to be able to shift your weight and have the uninvolved leg back and be able to bring that involved leg forward. And the benefits of that is that you're getting weight bearing on the bottom of that foot, but it's going to be less likely to point in this position because your knee is flexed. So I've talked about this in other videos, but when the knee bends, a lot of times the ankle will go out of that pointed position and the foot will lift up. So because the knee is bent in this position, that's a great way to work on weight bearing on that foot without the foot pointing down or having a higher likelihood of the foot being able to flex up. So I hope that made sense. The whole reason I went into this is I am going to be showing a couple of exercises coming up in the next week where you are in tall kneeling and you are in half kneeling. So I just wanted to prepare you all for that and give a little backstory on why it's so important. Now, remember, as I've stated in other videos, do not do these exercises if you have not done them before. I never ever recommend that you do a new exercise without first doing it with a physical therapist who can look and make sure you're not going to damage anything and that you can do it safely. Especially these two positions. I would say if you cannot roll over to your stomach, don't do it. And I would say if you have not worked on getting up off of the floor, do not do this exercise. So if you have not done these positions before, you really need to work with a physical therapist the first time you do it. So all that being said, I hope that explanation made sense. And if you're already doing these exercises, I hope that just motivates you to keep doing them, knowing all the wonderful benefits from them. And I guess that's all I have for today. If you haven't yet subscribed, go ahead and hit that subscribe button below. If you have subscribed and you haven't yet hit that notification bell, go ahead and turn on notifications so that you will be the first to know whenever I post new videos. As usual, like this video if you like the direction that I'm going with these alternative positions. If you have any questions, comments, concerns, please just leave those below. I would be happy to answer any of your questions. And until next time, you all have a great day.